So tell us a little bit about Hybridge. I guess you help educate dentists with a dental implant system that you have invented or put together. Tell us a little bit about it.
Well, we call it a protocol, and we think it's a unique approach. In dentistry, as we all know, we do things with a certain way. The things that we do often, we have really great timing, we have really great efficiencies. Implant dentistry has always been the exception to that in most offices. Most practices approach every case differently, and they never really get into a kind of a coordinated approach to doing complex cases.
All right.
So our Hybridge training and our certification is all about breaking down these cases in a way that they can approach them systematically with efficiency and predictability. Those that do these cases, a couple here and there, they'll complain of it takes forever. They have a hard time finishing the cases. The cases just keep going on and on. They're not sure if they're actually making any money doing these cases because the time and the expense of doing the cases is off balance with what they can charge for these cases today. So really, the full arch market has changed dramatically in the last 5 years, and those that are going to be doing full arch treatment in their practices are going to need to figure out a way to do it not only efficiently, but cost effectively if they're going to compete.
Now, we talked on the phone quite a bit, and I'm not a dentist, but I tried to understand that this Hybridge protocol is a 3-step process, 3 visits, and within 2 weeks, they get their permanent set of teeth.
So
is that right?
That's right. We actually call it Hybridge XD, stands for Express Digital, and so it's the first digital full arch process that I'm aware of out there. So imagine it's 3 appointments. It's initial records done well, and there's a certain protocol to how we capture what the patient is pre-treatment. Then there's the second visit, which is if it's a lower with teeth, it's extractions, implant placement, and scan. So we scan the patient the day of surgery, and then the patient goes with an interim lower appliance. They come back 2 weeks later for suture removal. We remove the sutures, and we put in the definitive Hybridge XD. The patient's all done 2 weeks later.
Is that, I mean, your practice, you're doing that?
We're doing it every day. And what it does is it actually creates such an efficiency and such a cost advantage to everybody that the cost has come down to a point where it's a win-win not only for the practice, but it's a win-win for the patient as well. And so there's a lot of patients who either can't afford to do conventional implant treatment, or they're afraid of the commitment of time and inconvenience and all that other.
You say they don't even, most people, I'm quoting you, you said don't even know their lab bill. With Hybridge, you know the lab bill.
We ask that question all the time. We ask a doctor, do you know how many clinical hours it takes you from start to finish? And they'll look and they'll, well, I think it takes us, 15 hours. I said, do you know how much that treatment costs you? Lab bill and implants, and they have an idea, but maybe they don't really know. And so the irony is that as business owners, as practice owners, we're constantly focused on our overhead, our cost. But what they fail to understand is that the biggest cost to them is their time. The thing that is the hardest to control is their time. So if I can take a doctor who does these cases, and they might do them well, but let's say that it's taking 12 to 14 hours from start to finish, and I can bring that down to 4 or 5 hours.
Is that what you're able to do with this Hybridge?
4 or 5 hours of total clinical time, and the key here is, can you hit the target? The target is you fulfilled the promise, the patient's happy, right? So we fulfill the promise, patient's happy, we're done with the case, and it doesn't linger out there for who knows how many weeks.
Even for somebody that's only been doing it.
We do it every day, and actually it's a mindset. People we're all so used to what we think is the best treatment out there. Hybridge XD has the potential to completely change the implant marketplace.
Is that right?
I really believe that it's a game changer.
So I understand this correctly. Okay, so the prices have come way down, but the chair time has gone way up. The hourly wage of the dentist has gone way up because of your protocol. Am I understanding it correctly?
Yeah, so the cost has come way down. So in our practice, we're charging half of what we charged 10 years ago. But our hourly productivity after expenses, after lab and after implant costs, the average hourly productivity has gone way up. So, which is an unusual thing. You know, that we obviously want to make sure that we're working at the highest level of our license. Hybridge XD allows you to work in the most productive way possible. I believe in dentistry altogether.
You know, I didn't tell you this, but I asked 2 of your Hybridge doctors or affiliates or whatever you're calling them, and I said, "What do you think of hybrids?" They go, "I wouldn't do it any other way. It's the most cost-effective, easiest way. The turnaround time is great. Patients love it."
For doctors who are looking to either do more of it, and in order to do more of it, they have to get better at it quick, or they're looking to change kind of the dynamics of their practice, maybe from a practice that did some implant and maybe some full arch, but the doctors that have been doing Hybridge for 1, 2, and 3 years, they'll tell you that not only has their practice completely changed, but the way they feel about dentistry today completely changed.
Is this the happiest group of patients? These people that you give their teeth back?
Yeah, I mean, who would have thought as dentists, right, that we would be able to do this for people? I don't think anybody that went to dental school ever thought that we were going to change lives.
Is that right?
Yeah.
Now, your dad kind of helped pioneer this with you, or something like that?
My father, Frank LaMar Sr., he got into implant dentistry in the 70s and got in a little too early because it wasn't working so well. And then by the middle 80s, he had gone all over the country, learned from all of the, Lenny Linkow, who was the father of dentistry or implant dentistry. But he brought it back to Rochester and was one of the first Rochester dentists who was doing implants with any predictability. And in 1986, my brother Jim and I were going to dental school, and he said, guys, you guys really need to think about implant dentistry as a focus of what you get trained on. And so we kind of trained accordingly. Jim trained on the surgical side. I trained on the prosthetic side. And my father was right, 1986. It took a while. You think about that inflection point of all those years where implant dentistry was just kind of, becoming more and more mainstream. But the inflection point is straight up right now. There's so many people, so many patients who know it's out there. It's going to be the practices that do it really well and have the confidence to hit the target and make people happy every time that are going to be the most successful later on.
I think you mentioned, so you've identified like 18 different scenarios to help the dentist put this together.
That's right. There are, a patient will present, we think, one of 18 different ways. And I'll just give you an example. So Randy, you present to the office wearing an upper denture and you have your lower anterior teeth with a partial, right? So you have an upper denture and you have your lower teeth. So that scenario, and then you choose that you're gonna have an upper Hybridge and a lower Hybridge. So that's one scenario, upper denture, lower teeth, to upper Hybridge, lower Hybridge. Think of all the combinations of care. Uppers and lowers we treat differently. Each protocol, each treatment sequence has to be tailored to the treatment scenario. And the situation that doctors get into is these different scenarios come in all the time, and they have to actually think through, well, how am I going to approach this case? What's the sequence? What's the order? How, am I going to do the upper first, the lower first? How am I going to... So there's a coordinated effort by not only the doctor, but their staff knows what the plan is, which is key. So it's not just in the doctor's head, this is how I'm going to do it. The whole staff knows this is an upper denture, lower teeth to an upper Hybridge, lower Hybridge. Here's the document. We're all going to follow this plan. And the patient also has the exact same plan. So the patient starting off treatment knows this is a 13-step process over a 16-week period of time, and the first appointment is initial records. They're there for 2 hours. This is what we're going to do. This is who's going to do it. The next appointment is 2 weeks later. The second appointment is the surgical appointment, the extraction of the teeth, the placement of the implants, the interim denture or the conversion prosthesis, and so on. And so every appointment has a next appointment, has a timing. Every doctor knows the situation where the patient calls and says, what's my next appointment?
Now, what is this XD you talk about?
Well, Hybridge XD is an immediate definitive restoration,
Okay.
which means the day that the teeth come out and the implants go in, we take a digital scan that day, and the patient goes home with an interim prosthesis for 2 weeks. So there are times where we'll do a conversion and we'll go through that whole process, but really because a patient's only going to wear their surgical appliance for 2 weeks, it's typically a removable appliance, and they come back 2 weeks later, believe it or not, they're 80% healed, the tissue looks good, we take the sutures out, and we deliver a definitive restoration that day. So they're all done 2 weeks later.
And everybody uses the same lab that's Hybridge?
Yeah, every Hybridge prosthesis is made the exact same way with the same materials. Our tagline, by the way, is a simple way to a lasting smile. So the simple way is, how do we do it as simply as possible, as streamlined as possible. And the second part is a lasting smile. Every dentist knows that every case they do, they're making a long-term promise to that patient. So it has to be a lasting smile. It can't, in 3 to 5 years, fall apart. So how we make the appliance, the metal substructure, the way that we make the teeth, the materials that bring it all together and fuse it all together, the passivity of it, everything is made a certain way by a group of 20 technicians that all they do is full arch.
Okay. Now, how does somebody get involved with Hybridge? What's the first step?
Well, we first call it Hybridge certification. So the first training session is a 2-day session. We call it Advanced Techniques in Full Arch. And that would be the starting point. We explain some of the philosophy and the way in which we coordinate care and what the actual protocol is. And from that point on, we consider that training to be the starting point of the evolution of gaining the capabilities to do the most complex cases out there.
Now, for the people, those that have been doing implant dentistry for quite some time, and then they find Hybridge, what do they like most about Hybridge? Like, what do you hear? What's the feedback?
Those that actually have done the most full arch treatment appreciate the protocol the most. Meaning they appreciate the fact that there's a set path and that it's the same approach every single time. And so, like anything else, if you do something the same way every single time, you get pretty good at it. Most doctors who are good practitioners, they're good implant surgeons, they're good restoratively, but putting that all together in a series of appointments that actually has some slickness to it, some speed to it, is really something that honestly, they could do what I did and have it take them 25 years to figure it out, or they can just follow the protocol of where we are 25 years later.
Now, I interview a lot of dentists on the show, and I don't pretend to understand all of this stuff, but I do know, because I talk to dentists, like let's say All-on-4, for example. It seems like everybody's doing All-on-4 different, or their version of All-on-4.
Yeah.
And so this is not like that. This is,
That's right.
your affiliates, I mean, everybody's doing it the same way.
Yeah, well, yes.
Sounds like an obvious advantage to doing it that way.
Well, when I asked the question, I say, what is All-on-4? And doctors will say, well, you take the teeth out, you put in 4 implants, and you put on an immediate prosthesis, and that's All-on-4. I said, well, is it the same way every time? How do you finish that case? Because when you put in a temporary, the day of surgery, I said, are you done with that case? And they said, well, no, at that point, we wait 3 to 6 months, and then we go back, and we start the case over again, and we do all the other steps of how to do one of these cases. I said, so there's no set protocol, it's just really a concept. Hybridge is actually a very defined protocol. It's a very specific, every single step has a criteria, a decision tree, and from start to finish, from initial records to delivery, every single step is defined for that doctor. And if they follow the recipe or the protocol, they'll get the same result every time.
Okay.
So that's a protocol.
So they go to the website, they can look at it. Could they call you directly? How do you prefer they start it before they even go to the 2-day?
Hybridgenetwork.com is the site that most doctors will go, and they'll learn about who we are. They'll learn about what the certification process looks like, and then they'll contact us. They'll call us, and then they'll usually probe a lot of questions. Everybody has a preconceived notion of how these things should be done, and so they ask their questions and they try to get comfortable. But that's probably the easiest way.
What's the number one question? Number one question you get?
How can you go to definitive restoration in 2 weeks? That breaks all the rules.
Okay, good.
And the answer is because you can. Because when we put these appliances in and we insert them at 2 weeks, we've looked back on many cases, consecutive cases, and we've brought them back in 3 and 6 months later, and we checked the implants. On 20 consecutive cases, we just finished the study, 100% of the implants were healthy and stable 6 months later, and their stability, their ISQ, which is an Ostel reading, 75% of the ISQ ratings went up after early loading, which breaks all the rules we learned about 25 years ago.
Is there anything we haven't talked about? Because we have about a minute left.
Well, we've talked about the protocol, but we really haven't talked about the prosthesis itself and the uniqueness of the materials that we use. So our prosthesis has been derived and evolved from experience. And I've been doing this for 25 years, and I've been putting hundreds and hundreds of these in the mouth. What we're looking for is the best materials, the most durability, feeling the most natural. So the Hybridge prosthesis is actually a unique set of materials that we think is the best prosthesis out there.
Okay, good. I've interviewed more than 4,000 doctors over the last 18 years. And I will say, if these aren't the best, these are like one of the best photos I've seen. Now, obviously, you bring your best photos here, but every doctor brings their best photos here. And these are the best I've seen. So is it because you're a prosthodontist? I mean, can a regular guy get these kind of results? These cosmetic results?
A regular guy who follows the protocol can get those results, but they have to follow the protocol. They have to follow the way in which we communicate with the lab, the way in which, not to get too complex, but there's something called prosthetic determinants. It's the key to a patient looking like that at the end, which is teeth in their appropriate position for the patient. And you can focus on the surgery and you can focus on all these things, but at the end of the day, these patients are coming in for teeth that look natural, and you got to be able to nail the restorative process, and that's a really large part of the Hybridge process.
Because when they look good, it seems like the referrals would go up as well.
Well, yes, that's true. Obviously, if we make somebody look good, then obviously they go out there and they tell people, and that's how our practice has kind of evolved over the years. Our reputation is based on happy patients.
How often do you have these lectures or events or training systems programs? And I know you have retreats and things like that.
Yeah. We're constantly training. We probably have training once a month, once every other month in various cities. Towards the end of this year, we're in Orlando, in Las Vegas, in Rochester, New York, which is our hometown. We're going to be in Dallas. So there are a lot of places around the country that we're doing Hybridge training today.
Okay, good. I want to thank you for coming on the Marketing Report.
I've enjoyed it. Thanks.